However, the health service's day-to-day budget is up 12% compared with before the pandemic. And people can't marry those two things up. Why is the NHS treating fewer people than pre-pandemic levels with 12% more money?
Yes, so the money is spent on services and things that they are going to do. Unfortunately, unless this is a big tragedy, Patrick, and we must talk about it, which is unless all the jigsaw puzzle pieces are in place, you cannot do that surgery. So we've had a lot of cancellations of that surgery, that oncology, that respiratory assessment, etc., because the other components of that have either been unavailable or cannot meet the demands, etc. What I mean is there has been a lot of sickness and unavailability of everyone at the same time to deliver on that healthcare. So that way you say, well, actually you've done less, but you've had some pay rise, more funding. But this is the way it works. It has to be everyone present at the same time.
I understand that, but the argument about inflation, which is the big one now, appears to fall down when one looks, according to the Institute for Fiscal Studies, that after adjusting for inflation, this means that the NHS has received 11.7% more funding in real terms. And so the inflation argument isn't an argument, is it?
So, look, whilst that funding goes to the National Health Service, it doesn't necessarily mean it goes into the pay packets of the healthcare workers.
So the funding
is for... it's not exclusively pay, Patrick, you see, and people have not had 11% pay rises. They've had 2% pay rises for a very long time. And in some years, the pay has been frozen. I was in the National Health Service when all our pays were also frozen for many, many years. And so this isn't a problem of today. This is a pressure cooker with problems building up over several years, unfortunately. And it is tragic. It's tragic that it comes to a call for strike action today.
I get that. I'm really keen to know. So when this money is given to the NHS, like this amount of money that was given, it was increased to £151.8 billion in 2022 to 2023, who decides what proportion of that goes on wages?
So it's multi-layered. So there is the independent pay review body which recommends pay rises, which successive health secretaries have ignored, considering they always approve their own pay rises. The independent body that was set up, independent body, keyword, recommends a pay rise, and it is often watered down. So there is the NHS executive, to which Amanda Pritchard heads it, and she reports to the Secretary of State for Health and Social Care. Unfortunately, this is a problem that has been going on for a long time. One more thing, Patrick, which I really must also share with our viewers and listeners, is this. That private finance initiative that was set up by successive governments, the blue and the red ones, has cost the National Health Service a lot of money. So we have mortgaged a lot of our expenses to private finance initiatives for which we are still paying, and it has made us poorer as a result.